front end. My name's Chloe from the Excel events team, and I just wanted to see if I could help out with the screen sharing at all.
No, we should be good. It was just the fact that I was on a different Mac.
So okay. Alrighty, well, I'll jump out then so I'm not kind of a surprise guest, and I'll go back to the front end. I do have access to this backstage chat that you guys can see on the right, so if you do need my help with anything, Paul, I did send you a message, so if you need to respond or anything like that, I'll be right there, but I'll jump out so you can get right back to the agenda.
Get the screen up right here.
And it says we're broadcasting live, so I think, right? We should be.
Yep, it looks like we are live. So I will go ahead and I'm going to jump out.
Okay. So Paul, as soon as you can make sure that you can share your screen, I'll jump out and just do the best you can to share the important points.
Can you see the screen now?
Yep.
Wonderful. Let me go ahead and get started. So, great. Is that fine?
Yep.
Great. Thank you so much. My apologies for the technical difficulties. My name is Paul Mehta. I'm the PI of the National ALS Registry, and this talk's going to go over how you can join the fight against ALS. I want to thank the Florida ALS Association chapter for hosting this event. Certainly, having virtual is always a challenge, and kudos to you guys for having it. No disclosures for myself. The outline of the presentation, we're going to go over how you can join the fight against ALS, the importance of the National ALS Registry, and why you should join our National ALS Biorepository. What is it, and why is it important, and how you can join, and how you can also join the clinical trials and the studies that we help to recruit for, and why take our risk factor surveys. Also, what is the registry doing to find the causes and the risk factors for ALS, reporting on who gets ALS in the U.S., the research that we're funding, as well as publishing as well. We have a couple of videos which I don't believe I can play, and then we can go to questions shortly thereafter if there's any time remaining. Very quickly, so we do a lot more than just count ALS cases at the National ALS Registry. So we have the National ALS Biorepository, which I'll go over very quickly. But this biorepository is instrumental in looking in areas such as genetics, biomarkers, and so forth. We also do the epidemiology of ALS in the U.S., where we look at incidence, prevalence, and mortality of ALS cases. We work with a partner organization such as the ALS Association, which is one of our most important partner. We have risk factor survey data, which ALS patients can take in the comfort of their own homes, and also with the assistance of their caregivers as well. We have the research notification mechanism, where patients can learn more about clinical trials and studies, and we also fund research. So what is the National ALS Registry, and why should you join? So there are more unknowns and knowns about ALS, and the registry allows people to fight back and help defeat this disease. So the goals of the registry are multifold. We want to find out what causes ALS, the etiology behind ALS, as well as the risk factors. And we also publish on the number of ALS cases in the U.S. as well. Like I mentioned, the incidence, number of new cases, and prevalence, the existing cases. We also collect data, we analyze data, we fund external research. We also connect people living with ALS with clinical trials and research studies, as well as collecting biospecimens through the National ALS Biorepository. So like I said, we do a lot more than just count ALS cases. So very quickly, how many cases of ALS are in the U.S.? But let me just first say, one case of ALS is one too many, full stop. We want to make sure we can figure out what causes this disease and go ahead and have treatments for it, and certainly stop, halt ALS, which is really, really important. In the U.S., ALS is not a reportable disease. So what that means is, so if a state or if a neurologist has an ALS case, they don't report it to the state, and the state does not in turn report it to us. It's different when it comes to, let's say, the flu or even COVID-19, or tuberculosis, or other communicable diseases. In the U.S., ALS is not reported. So because of that, we had to go ahead and, with the exception of Massachusetts, is the only state where ALS actually is reported. So some of the challenges we have is, private insurance databases, they don't give us information on exactly names and so forth. So without the names, we actually can't match up who's in the registry. And since we're also a surveillance system, it's hard to capture all the cases of ALS in the U.S., but we feel we probably have captured between 80 and 85% of cases through areas such as the Medicare, the VA system, as well as our online portal. So how many cases are there in the U.S. right now? We estimate there's almost 17,000 cases of ALS in the U.S., a little bit over 16,005. And so, like I said, I know we're missing cases from for example, private insurance. And we're certainly looking to have better case ascertainment methodologies in the near future. So what that equates to is about 5.2 cases of ALS per 100,000. And so ALS continues to be more common in whites, males, and persons between the ages of 60 and 69. Males have a higher prevalence than females. And we're not sure why males are more heavily impacted by ALS than females. That's also one of the mysteries behind ALS. So we also have something called the risk factor surveys that patients can take when they join the registry. And these risk factor surveys are very, very important. So it helps us scientists learn more about, for example, the occupations, if there are certain occupations which are at higher risk for ALS than others. Military service, why do vets get ALS at a higher rate than non-vets? Physical activity, smoking, and drinking, are these potential risk factors? We know smoking appears to be a risk factor for ALS. Where have you lived? As well as, for example, pesticide use. Pesticide use such as insecticides, as well as other sorts of sprays and so forth. Traumatic brain injuries. Did you ever have a concussion or a TBI? Disease progression. So we also have a survey which is kind of like an ALS FRS survey, which allows patients to take it when they first join the registry, and every 6 months taking this particular survey. It's called a longitudinal survey, where we can gauge the actual progress of an ALS patient. And we also have one survey called the open-ended survey, which allows patients to tell us what they think may have caused their disease. So I think it's really important, for these surveys to be taken, so we can kind of help solve the mysteries behind ALS. Currently, we have 17 risk factor surveys, and this actually equates to over 93,000 completed surveys. Like I mentioned, this ranges from demographics, occupational history, military history, and so forth. And we certainly encourage you to take these surveys, in the comfort of your own home, as well as assistance with loved ones, caregivers, and so forth. There's no reason to take these surveys all at one time. You can take them at your leisure and so forth. So, National ALS Biorepository, what is it? Well, the Biorepository helps researchers in the areas of genetics, for example, looking for genes. There's always new genes being identified for ALS. Biomarker identification, so helps us examine disease progression, how fast or slow ALS progresses. Also sees if certain drugs will work or not. And also, one of the goals is to actually have some sort of diagnostic test for ALS. Right now, there is not a blood test for ALS like there is for other diseases out there. So it'd be great to have a blood test to actually rule in or rule out ALS. And we're also looking at environmental factors such as exposures to heavy metals, pesticides, insecticides, and so forth. Some more details on the Biorepository. So this is certainly different. So all those risk factor surveys I showed you guys earlier, those are actually matched with all the biosamples as well. This Biorepository also is beyond the referral center. It's coast to coast. And so we go from, like I said, coast to coast, and we go to your home to go ahead and collect these samples. A phlebotomist comes to your home to collect these samples. It's completely free for patients. We don't actually charge anything for this. This is a free service. And, we hope to be, in about 3 to 5 years, one of the largest collection of ALS samples in the world, and certainly helping to facilitate research on genetics, biomarkers, and disease progression. This is a quick schematic of the Biorepository itself, our in-home collections of blood, urine, saliva, as well as a post-mortem component, such as bone, brain, spinal cord, CSF, and muscle. So these risk factors are coupled with all the patient samples, and the specimens are then sent out to researchers for their work. We also help support clinical trials and epidemiological studies, and so we know recruitment can be very, very difficult for these clinical trials, and so we want to make it as easy as possible for drug companies to find their patients for these clinical trials. So to date, we have actually over 50 institutions who've actually used this system. These are some of the highlighted ones that have used the system. Brainstorm's Neurone is certainly one of them. Orphazymes, as well as Orion Pharmaceuticals, Omolix, Cytokinetics, and a number of other ones as well. I could not all list them on one slide. We also fund research. Research is also very, very important. So we actually funded 19 research studies. We added 2 more this year as well. And research is very, very important, certainly to figure out what causes ALS and those risk factors like I mentioned. And some of the areas of study that we are doing is we're looking at environmental risk factors such as cyanobacteria, which are these harmful algal blooms which happen in bodies of water. And so this is certainly an important area to look at. Pesticides, pollutants, as well as the role of hyperlipidemia, diabetes, and other autoimmune diseases, and their role in ALS. Genetics is also very, very important. We also want to figure out why ALS affects certain populations more so than other populations, biomarkers, and so forth. These are some of the currently funded institutions for the registry: Northwestern, University of Michigan, University of Pittsburgh, Columbia, Harvard, Dartmouth, and Trinity College in Dublin. And so just very in closing, the impact of the National ALS Registry. So we are the largest database of ALS patients in the U.S. for research. We're working with drug companies and academia to provide recruitment assistance for clinical trials and epidemiological studies. We're advancing ALS research on biomarkers, genetics, and environmental exposures through the National ALS Biorepository. We're funding research to leading academic institutions to figure out what causes ALS. We're also looking at the epidemiological trends of ALS, whether it's incidence, prevalence, or mortality. So in essence, we're looking to figure out the who, the what, and the why of ALS. So just in conclusion, so the registry and the ALS Association have the same goals in mind. We're both on the same page here, and with the ultimate goal of figuring out what causes ALS and having a cure for ALS. Thank you.
Thank you, Paul, for that very informative presentation. We will now have a short break. Please remember to click on the expo to visit our sponsors or visit our virtual learning lab for hands-on presentations. We will see you back here at 10 o'clock